Hey everyone, super excited. We got Steve Zadig, who's the CEO of VitalConnect, and you might have saw this patch in an earlier interview. And we've been talking about sensors. You're in the panel with sensors today.
That's right, we are. We're a sensor company. We're basically a platform company exclusively looking at sensors. We're not looking at the end markets because we think that that brings a level of expertise and challenges. And what we want to do is make the best sensor in the world, the best sensor platform, so that we capture data on the human body, and we think every body is different, by the way, and move that data up to the cloud by using a relay, which could be your cell phone, it could be a passive relay in the wall, it could be something that you wear if you're elder on your body. We call that a persistent relay, like a watch or something that hangs from your neck in the form of a pendant. But you know, our goal here is to provide the very, very highest quality biometric data streams. We've elected, although not exclusively, to the form of a patch, and we want to make sure that those data streams are clinically accurate, but really, really important is to make sure that we can deliver them at the lowest possible cost.
Okay. Yeah, so what's interesting is there's all kinds of new materials and ways to fabricate these, so they're actually becoming consumer, and the price points are coming down.
That's right. I mean, I think that, you know, in the consumer space, so let's say, Tim, you care about your mom and dad, and I know you do, and they want to live out their lives in their home and don't want to go to that place where the old people go.
Living in place.
Yes, that's right, living out their lives in place. But they're going to get older, more frail, and I'm sure you're worried about them, right? Because you can't be with them all the time. And so if they were to wear the patch, by virtue of how we locate it on the body, we've developed what we think is the industry-leading falls detection and motion detection.
Oh, really?
Yeah, and we can see are they laying in bed? Are they running a fever? God forbid that they fell and hurt themselves, and we can automatically notify you, we can notify their caregiver, their physician, we can notify the 911 services, so that you have the peace of mind and they have the peace of mind that they're being watched over and that they can maintain their independence.
So, Steve, what is in this patch? Is there multiple sensors in here, and how does it work?
Yeah, there are. There's multiple sensors. The device is basically what we call a single lead ECG, which means it has 2 electrodes. Those electrodes then capture data from the body. We also have a thermistor embedded in the device that allows us to measure your skin temperature. It has a triaxial accelerometer. It has a very, very powerful processor that can then fuse that data. There is a very powerful processor in there. We have some unique technology that allows us to operate that processor, and this device can be worn up to 3 days continuously. You can shower, you can bathe, you go about your activities of your daily life. As a matter of fact, about 60% of the people that wear this remark to us that they forgot that they wore it, and so it's very, very comfortable.
And then that's a smaller version?
Yeah, so this is just a motion detection system. So this is exclusively for someone that might not have a chronic disease or concerns about chronic disease. So this has the ability then to measure their steps, measure their posture, measure their falls, and measure their body temperature. And the other thing that's very attractive about this size form factor is that if somebody, sadly enough, might be slipping towards dementia or have Alzheimer's, is that we can place this anywhere on the body, a place that they can't reach. They can wear it for up to 7 days, and we can, for a very, very low cost, provide that data to you, to the caregiver, and the rest of the system.
So this is an enabling technology as part of an ecosystem, and I could be an entrepreneur and then engage with this, and I'd get an SDK and some tool sets to build technology on top of that?
Yeah, again, we're building a very, very robust platform, and that platform provides qualified and quantified data streams, and then those data streams can be taken by our partners and turned into a very valuable differentiating product that they go into their vertical markets that they know intimately about, and characterize that data to serve that market.
So as the Chief Operating Officer going through this and bringing it to market, what are some tips you could give to other companies that could learn from your experience?
Well, like most things in life, if you're an entrepreneur, you tend to enter a project with a lot of optimism and not a lot of real knowledge about how difficult it is. And we found out that this is a very, very difficult thing to do correctly. But I think we've heard today in the sessions that you You need to plan. You need to figure out how you're financially going to have your capital. You need to figure out what your resources are, your go-to-market. And clearly in this space, you need to understand the regulatory climate, because that's a huge, huge effort.
Interesting. So has this gone through regulatory?
Well, we're just, we finished our ISO 13485 earlier in the year. We've submitted for our CE mark, and we're just on the verge of submitting our first 510 clearance submission. So,
how game-changing is this sensor space, and what's it going to look like down the road?
Well, I think, sensors are interesting. I think that they're becoming ubiquitous around us in our lives. I think that the sensors and the form factors with which you engage them have a lot to do with how precise they can be and what value and quality of data they can present. So in that sense, I think we're going to see more and more sensors around us. I mean, when you get into your car, there's probably hundreds of sensors instantly.
We know more about our cars than we do about ourselves.
Well, that's exactly right. You get into your car and it says your left front tire is down a little on pressure, you need to change the oil, et cetera. Well, what about the human body? I mean, we want to have that same kind of data, those same kind of opportunities. But at the same time, we want to present it in a meaningful, actionable way so that people aren't in data overload, because then they tune it out, and so our hope is that with this infinitely programmable device that we've created, we can give you just the right amount of data for the right application, and then you can do something about it. At the end of the day, we're humans. We have to change our behavior. We have to make change in our lives, and no sort of second order or synthetic device is going to cure everything for us. But at the same time, without that knowledge, we don't have choices.
So, Steve, what types of partners or different opportunities are you looking for to get out of this conference?
Well, we're interested in anybody that serves a reasonably sized market that can help affect change and has an established client base. We are engaged with a number of Fortune 100 companies, and we see that they can integrate this into their product offerings, enrich those product offerings, create higher value add, in some cases rejuvenate their apps if they were an app company, and bring a higher level of value and defensibility through well researched and well thought out use of this technology.
Great. Well, thanks so much for your time. So people can connect up with you at
VitalConnect.com.
VitalConnect.com.
Thank you, Tim.
Cheers.
Okay.